Welcome to the FitMisfit channel. If you enjoy our content, don't forget to like this video and subscribe for more. Now let's dive into our topic for today. Have you ever experienced a sports injury that set you back in your fitness journey? It's a common tale, unfortunately. But what if I told you it's possible to tip the scales in your favor? That's right, we're talking about injury prevention, a topic that often gets overshadowed by the glitz and glamour of performance enhancement. Central to injury prevention is the of strengthening weak areas. It's like fortifying the weakest link in a chain. You see, our bodies are intricate networks of muscles and bones, working in harmony to perform movements. But sometimes, certain muscle groups are disproportionately weaker or tighter than their counterparts, causing what we call muscular imbalances. These imbalances can disrupt the harmony, leading to altered movement patterns, joint instability, and ultimately injuries. So let's embark on a journey of discovery empowerment. Let's explore how to identify these weak areas and work on strengthening them to prevent injuries. Muscular imbalances occur when certain muscle groups are disproportionately weaker or tighter than their opposing counterparts. Picture this like a tug of war, where one team is far stronger than the other, causing an imbalance that can lead to potential injuries. For example, let's talk about weak glutes. These are the muscles in your buttocks which, when weak, can lead to lower back pain, hip instability, and even knee injuries such as patellofemoral pain syndrome. That's because your glutes are essential for supporting your body during many movements, from walking and running to lifting heavy objects. When they're not pulling their weight, other areas often bear the brunt, which can lead to pain and injury. Next, let's discuss unstable shoulders. The muscles that stabilize your shoulder joint, known as the rotator cuff, are often weaker than the larger, more dominant muscles, like your pectorals and deltoids. This imbalance can increase the risk of shoulder impingement and rotator cuff injuries. It's like having a door with one weak hinge. It just doesn't swing as smoothly, and over time, it can lead to damage. Finally, tight hip flexors are a common issue, especially for those of us who spend a lot of time sitting. These muscles, located at the front of your hip, can become tight and cause weakness in the opposing hip extensors, like your gluteus maximus. This can result in poor posture, lower back pain, and hip-related issues. Imagine walking with a heavy backpack on one shoulder all day. You'd likely end up leaning to one side to compensate, which could cause discomfort or even injury over time. These are just a few examples of how muscular imbalances can lead to injury. But it's not all doom and gloom. The good news is that by identifying and addressing these imbalances, we can significantly reduce our risk of injury and improve our overall physical health. Now that we understand what muscular imbalances can do, let's look at the importance of addressing these weak areas for injury prevention. Addressing weak areas and correcting muscular imbalances is crucial for injury prevention and overall musculoskeletal health. Now, let's discuss why this is so important. When we give attention to our weak spots, we improve movement efficiency. Balanced movement patterns mean less strain on joints and tissues during physical activity, reducing the risk of injury. Next, let's talk about joint stability. Strengthening the muscles around our joints improves stability and helps to prevent problems like ligament sprains and tendinitis. It's like fortifying the foundation of a building, making it more resistant to damage. Lastly, focusing on weak areas can optimize performance. A balanced musculature promotes optimal biomechanics, enhancing athletic performance by maximizing power output and reducing energy wastage. It's like fine-tuning a machine to make sure it's running as efficiently as possible. So how can we strengthen these weak areas? Let's dive into some targeted exercises. There are specific exercises that can help you strengthen weak areas and reduce the risk of injuries. Let's dive into a few. Firstly, if you have weak glutes, exercises like bridges and lateral band walks can be incredibly beneficial. Bridges target the glutes and hamstrings, improving hip extension strength. This can lead to better stability and less strain on your lower back and knees. Lateral band walks, on the other hand, target the gluteus medius. This helps improve hip stability and reduces knee valgus, the inward collapse of the knee that can lead to injury. Now let's talk about unstable shoulders. If this is an issue for you, consider incorporating exercises like external rotation with resistance bands and prone YWT exercises into your routine. The external rotation exercise strengthens the shoulder's external rotators, helping to stabilize the joint and reduce the risk of injury. Prone YWT exercises engage the rotator cuff muscles and scapular stabilizers, improving overall shoulder function and reducing the likelihood of issues like shoulder impingement. Lastly, if you're dealing with tight hip flexors, a combination of stretching and strengthening exercises can be beneficial. Regular hip flexor stretches can alleviate tightness, improving your posture and reducing strain on your lower back. On the strengthening side, Romanian deadlifts target the glutes and hamstrings. This helps counteract the effects of prolonged sitting and weak hip extensors, reducing the risk of hip-related issues and lower back pain. Remember, these exercises are not a one-size-fits-all solution. They are examples of targeted exercises that can help address specific muscular imbalances and weaknesses. It's always important to listen to your body and adjust your routine as needed. If you're unsure about how to perform these exercises or if they're right for you, don't hesitate to seek professional advice. While these exercises are beneficial, it's equally important to incorporate injury prevention techniques into your routine regularly. In our next section, we'll discuss practical tips on how to do just that. Stay tuned. Incorporating injury prevention techniques into your routine can go a long way in keeping you injury-free. One of the most effective ways to do this is by performing regular assessments. These can either be self-conducted or done by a fitness professional. Assessments help identify any muscular imbalances or weaknesses that need to be addressed. Prioritizing mobility and flexibility is another essential tip. Regularly stretching and engaging in mobility exercises can alleviate tight muscles, improve joint range of motion, and reduce the risk of injury. Lastly, warming up properly before workouts is crucial. A good warm-up increases blood flow, raises body temperature, and prepares your muscles for the exercise ahead. It's not just about doing a few stretches. Aim to incorporate dynamic movements that mimic the activity you're about to do. Remember, a balanced body is a stronger, more efficient body. So, make injury prevention a priority in your fitness journey.